Welcome! In today's videocast session, we'll demystify the alphabet soup of informatics-related standards that quietly power every electronic medical records click and data exchange you oversee. From the venerable HL7 messaging rules and SNOMED to ICD-10 code sets, these shared grammars enable our disparate systems to communicate in a common language, safeguard patient safety, and ensure regulatory compliance. We'll explore who writes the rules, TING, HL7 International, ISO, and government agencies, why consensus matters, and how you, as healthcare managers, can champion compliance while steering innovation. Let's translate tech jargon into strategic leadership together today. So, the objectives of this section are to focus on why consistent language and data rules are the secret engine behind trusted information sharing. First, we will explore how agreed upon vocabularies and data formats let health information exchanges truly communicate, lifting barriers between laboratories, clinics, and public agencies. Next, we will examine multidisciplinary standards that integrate medicine, pharmacy, imaging, and public health, enabling each to contribute to a unified, reliable patient narrative. We then zoom in on nursing languages that capture assessments, actions, and outcomes, making bedside knowledge visible for the whole team. We will also see how bringing different system standards into harmony saves costs, reduces integration pain, and prepares organizations for future innovation. Finally, we will show how selecting the right terminology early in any data exchange project secures clarity, safety, and long-term value. Dive into Chapter 4 of your textbook for richer examples and practical guidance. Interoperability. So, interoperability is the connective tissue of modern care, and the Centers for Medicare and Medicaid Services link financial rewards to prove that your organization can share information seamlessly. To earn these incentives, certified electronic health records must capture data with recognized vocabularies such as the International Classification of Diseases for Diagnosis, the systematized nomenclature of medicine, clinical terms for problems, and logical observation identifiers, names and codes for laboratory values. That structured content must then travel between settings through exchange formats such as Health Level 7 messages, clinical document architecture summaries, and fast healthcare interoperability resources interfaces. Finally, the system must use that data to deliver real-time decision support, guiding clinicians with warnings, reminders, and evidence-based suggestions. For healthcare managers, this trio of requirements turns interoperability from an IT project into a strategic mandate. Meeting them protects reimbursement, elevates quality metrics, reduces duplicate testing, and positions the organization for collaborative, value-driven care models. Multidisciplinary terminologies. So, multidisciplinary vocabularies or terminologies form a shared reference library that enables clinicians, coders, and finance teams to work together in the same direction. Logical observation, identifiers, names, and codes assigns a precise tag to every laboratory result, vital sign, or bedside assessment, ensuring that the information travels seamlessly from analyzer to electronic on record to quality dashboard. The systematized nomenclature of medicine. Clinical terms extends that clarity to diagnosis, procedures, body structures, and substances, ensuring the care plan stays consistent when handed off across settings. On the revenue side, the International Classification of Diseases captures why the patient was treated, current procedural terminology captures what was done, and diagnosis-related groups bundle those data into payment classifications that drive value-based contracts. Aligning documentation with these vocabularies eliminates duplicate entries, enhances outcome reporting, and ensures revenue integrity. For managers, championing staff training and interface mapping around these code sets is essential to unlock reliable analytics and sustainable reimbursement. Standards. Setting organizations. So, 3 organizations write the rulebook for digital health. HL7 builds the messaging framework that shuttles orders, lab results, and clinical summaries between disparate systems. SNOMED, governed by the International Health Terminology Standards Development Organization, IHTSDO, supplies the master vocabulary that makes those messages clinically precise and computable. The Healthcare Information Technology Standards Panel, HITSP, consolidates dozens of specifications, network protocols, device feeds, and public health reporting guides, so everyone follows a single, coherent playbook. For healthcare managers, recognizing these acronyms is more than trivia. Vendor contracts should reference the latest HL7 implementation guides, SNOMED releases, and HITSP interoperability profiles to avoid expensive retrofits. Recall, a retrofit is an upgrade made to an existing system, building, or piece of equipment after it has already been put into service. Internal governance groups can map documentation, analytics, and reimbursement projects to the same standards roadmap, ensuring data remains reusable across quality reporting and value-based payment programs. Finally, monitoring HL7 ballot cycles, SNOMED extension schedules, and HITSP updates provides healthcare managers with early warning of regulatory shifts, allowing the organization to budget, train, and upgrade ahead of looming deadlines. Harmonization. So harmonization is the disciplined process of aligning multiple clinical vocabularies and message formats so they work together without loss of meaning. Cross-mapping among systems linking a blood glucose concept in LOINC, logical observation, identifiers, names, and codes, to its matching term in SNOMED CT, systematized nomenclature of medicine clinical terms, and its billing code in ICD, International Classification of Diseases, creates a translation layer that preserves clinical intent as data move from bedside device to electronic record, quality dashboard, and payer claim. For healthcare managers, this is more than an IT exercise. It is the foundation for reliable analytics, risk-based contracts, and patient safety initiatives. When harmonization is well governed, data sets from laboratories, pharmacies, imaging, and population health programs merge to reveal gaps in care and drive targeted interventions. Decision support engines fire the right alerts because they recognize equivalent concepts, reducing override fatigue. Revenue cycle teams spend less time on manual recording, accelerating cash flow, and lowering denials. Harmonized data also travel cleanly to public health registries, satisfying reporting mandates with fewer staff hours. Achieving this state demands investment in terminology services, interface engines, and workforce training, but the payoff is broad. Lower integration costs, richer predictive models, and streamlined compliance audits. Managers who champion harmonization position their organizations to thrive in an economy that rewards coordinated, data-driven care. Quality monitoring. So quality monitoring turns raw clinical documentation into actionable insight. Once every diagnosis, procedure, and laboratory value is stored with common codes. Standardized data can be safely merged across the electronic health record, billing systems, staffing rosters, and external registries, producing a unified view of care delivery. With this panoramic data set, managers and clinicians can compare current practice to evidence-based benchmarks, flagging unnecessary tests, suboptimal medication choices, or delays in follow-up. Trend analysis reveals whether new policies, such as sepsis bundles, bedside shift reports, or telehealth triage, actually improve mortality, readmissions, or patient experience scores. By pairing outcome trends with nurse-to-patient ratios and workload acuity, leaders can quantify how staffing decisions affect safety events and length of stay, strengthening the business case for optimal coverage. Standardized quality indicators also feed pay-for-performance contracts and public scorecards, reducing the manual abstraction work that once drove reporting costs. For healthcare managers, investing in accurate coding, robust data integration, and intuitive dashboards is therefore strategic. It accelerates continuous improvement cycles, supports regulatory compliance, and builds trust with clinicians who can see transparent, timely evidence of their impact. Ultimately, effective quality monitoring translates data discipline into better care and stronger financial performance. In conclusion, thanks for joining our chat on why standardized language underpins every strategic move in digital health. Think of terminologies as the Bluetooth of clinical data. Once devices pair, the conversation flows. When a glucose panel is labeled with a LOINC, its diagnosis coded in ICD, and the treatment plan captured in SNOMED, we can stitch lab, billing, and progress notes into one coherent story. Cross-mapping keeps that meaning intact as data travels from bedside to analytics dashboards, fueling alerts, eliminating duplicate tests, and revealing population trends. Federal incentives add muscle. By tying payments to interoperability, the Centers for Medicare and Medicaid Services push organizations to adopt HL7 guides and HITSP profiles that move these codes safely across networks. Harmonization trims interface costs, curbs manual recoding, and lets managers watch how new protocols or staffing tweaks ripple through infection rates, length of stay, or readmissions. Health practitioners recognize the benefits of using standardized terminologies and are actively participating in the development of both discipline-specific and multidisciplinary vocabularies. As patient engagement with electronic records increases, clinicians must also shape consumer health language. With standardized terminology, patient data become available across the full spectrum of care settings. Your task as future leaders is to steward the governance, training, and technology that keep this engine running. Thank you for listening. Your curiosity moves the profession forward. For a deeper dive, read Chapter 4. It is the definitive playbook on this vital topic.